I'm Dr. Kelsey Lunt, owner of Lunt Chiropractic, and I'm here to talk to you a little bit about migraines today. So there's multiple areas that we address when we're dealing with a migraine patient. The first is going to be traditional chiropractic technique, where I'm going to get into the musculature, especially at the base of the neck, the suboccipitals, in through the paraspinals, which are the muscles that surround your spine, because a lot of these muscles have a tendency to correlate with headaches as well, especially those suboccipital muscles right at the base of the neck. These will get contracted in people who do a lot of computer use, a lot of phone use, things like that, where we have a tendency to kind of come forward with our neck, which sort of kind of pinches at the base of the neck and contracts those muscles even further. So on top of the traditional chiropractic side of things, we would also be making a lot of nutritional recommendations. The first of which is to drink more water, because that is the #1 cause of headaches typically. Second of which would be a magnesium supplement. This is also being more highly prescribed by neurologists who treat migraines, because it is extremely beneficial in order to kind of regulate and take care of some of those headache symptoms and the migraines. One of the other treatment techniques that we're going to give patients who suffer from migraines are going to be some ergonomic changes and stretches that they can start to do. One of the main things that people can start to do who suffer from migraines is something called a chin retraction. We've touched on this in a couple of our previous videos, but it's one of the main ways that you can kind of help yourself outside of the office setting in order to alleviate some of the strain in the back of the neck. It's one of the only maneuvers that we can really do in order to stretch the base of our skull in through where those suboccipital muscles are in order to alleviate some of those tensions. So we're going to start by having her sit up nice and straight and pull the shoulders back a little bit. She's then going to posterior translate the neck. She's going to tuck the chin forward, and then she's going to push back even more, again inducing a nice deep stretch in through the base of the spine right here. The other way that you can help that along a little bit more naturally is by making sure that you continue stretching those pecs out. As the shoulders sit back a little bit, it becomes harder for you to jut forward at your neck, which is what we don't want anyway. So it'll be easier for you to maintain that natural posture where you're keeping the ears in line with the shoulder and a more neutral spine in through the neck. That would be considered more of the stretch. The ergonomic change would be that you want to concentrate on doing this posture whenever you think about it. If you're on the computer, you're at work, you're driving for a long period of time. So instead of being jutted forward from the neck, you're just going to kind of pull that head back into a more neutral position, trying to keep the ears in line with the shoulders.